When a human heart is completely deprived of oxygen, its vital muscle tissue suffocates, stiffens, and turns gray. Because cardiac tissue lacks the ability to regenerate itself, this localized cellular death is permanent. That dead tissue creates a destructive cascade. The rest of the heart has to pump harder to compensate, stretching and weakening the surrounding muscle. A single cardiac event initiates a compounding, lifelong physical decline. Infants born with congenital metabolic disorders face an even steeper biological wall. When a child lacks a specific liver enzyme, their body cannot convert toxic ammonia into urea, a deficiency that has historically been unfixable and lethal. For generations, physicians focused on managing these symptoms or surgically bypassing blockages. They operated in a reactive mode because they lacked the tools to trigger biological healing. In August 2024, a newborn named KJ was born with a urea cycle disorder. Lacking a critical liver enzyme, toxic ammonia levels began rising in his blood and brain within days of his birth. Adults like Melissa Murphy and Jeff Brees faced a different version of this crisis, jolted awake by the sudden, crushing chest pain of major heart attacks. Their cardiac tissue was actively dying, leaving them pleading for survival in the back of an ambulance. While KJ, Melissa, and Jeff survived their initial traumas, long-term health required a shift in strategy. They represent a new cohort of patients receiving therapies designed to regenerate failing biology, rather than just patch it. This shift begins at the smallest possible scale, the patient's genetic code. Baby KJ was transferred to the Children's Hospital of Philadelphia for emergency dialysis. This filtered the ammonia from his blood, buying his medical team a narrow window to address the genetic cause of his liver failure. Researchers designed a CRISPR base editing therapy specifically for KJ's genetic variant. They packaged the tool inside lipid nanoparticles, which dock with liver cells and swap a single faulty genetic base pair. 6 months later, KJ received the infusion, the first personalized genetic treatment successfully instructing his DNA to manufacture the missing enzyme. This intervention corrected the microscopic root cause, effectively erasing the diagnosis. KJ's ammonia level stabilized, allowing him to take his first steps and spend his first Christmas at home. While pediatric specialists edit DNA to prevent damage, researchers at Columbia University are finding ways to repair tissue after it has already died. For adults with severe blockages, the standard fix is a coronary artery bypass, a major operation requiring a significant chest incision. The Columbia team is testing a less invasive approach, a simple injection into the arm. The injected self-amplifying RNA instructs arm muscle cells to produce pro-ANP. These molecules circulate to the heart, where the enzyme corin transforms them into active ANP. The hormone attaches to scarred tissue, reducing inflammation and triggering the growth of new blood vessels. This remarkable biology mimics the regenerative environment of a newborn's heart, bringing the dead zone back to life. This therapy proves that the heart isn't just a mechanical pump. With the correct biochemical signals, the organ can be commanded to rebuild itself. Even when a genome is edited or an organ is repaired, the sudden trauma of a life-threatening event often leaves a lasting psychological impact. Science can fix the biology, but it cannot instantly erase the memory of the crisis. Jeff Brees describes his recovery as a series of zigzags. Despite his medical success, he required years of intensive therapy to manage the severe anxiety and depression that followed his heart attack. Repairing cellular damage is the prerequisite for survival, but true recovery requires addressing the patient's mind with the same precision as their heart. This reality has led to the hybrid rehab model. This clinical shift treats mental health and anxiety management as a critical part of physical rehabilitation. Institutions like the Cleveland Clinic operate as integrated ecosystems. A patient's recovery involves a coordinated team of dedicated cardiologists, around-the-clock nurses, expert nutritionists, and therapists, all working seamlessly together. This clinical model actively incorporates family members into the medical process. Specialized educators work with spouses and children, treating the patient's emotional support network as a core part of the recovery protocol. Technologies like CRISPR and RNA injections provide a second chance at life, but it is the dedicated, compassionate care teams and the unwavering support of family that make that second chance sustainable.